present, distinguished delegates present, very good morning. I'm Charles Tanui, and I'm going to take you through the policy outlook from the African, urban, and subnational perspective. And to kickstart, we have a framework called Sendai Framework on disaster risk reduction, which was agreed upon by the governments in 2015 globally in Sendai, and they agreed upon to develop or support the countries and local governments to develop the disaster risk reduction strategies. And also we had the local and subnational governments, they had a declaration to push forward, especially bringing all the communities in agreement with the target E of the Sendai Framework, and really support the preparedness of contingency policies to incorporate disaster risk reduction in the different sectors and different community activities. But what has been achieved so far, especially in African context, you only have 38% of the reported subnational entities, that is among the 21 countries, which were assessed by the African Union. So it tells us that there's a lot of work that needs to be done. And let me share some perspectives in terms of disaster risks in Africa. And so far, we are faced with the triple threats, especially the Great Horn of Africa, where we have had locust, invasion, floods, and COVID-19. And the epicenter has been largely in the urban areas. And some of the measures which have been put in place, including the lockdown, the curfews, have had some socioeconomic impacts. And where this impact has been felt so intensively is especially in the poor or vulnerable communities, especially in the slum areas. And if you look at the case for Kenya, 81%, as per the assessment done in April, have actually lost some job opportunities. When we try now to look at how can we frame especially the urban disaster risk reduction and risk management in the urban sector, and we look at some of the scientific work which have been done, and Nomadine and Mark Pelling and colleagues really looked at there is need in terms of building the urban resilience, but how can urban resilience really be executed? So it promotes the policy agenda, governance, integrated and collaborative approaches. And of course, there is the urgency to also incorporate or get political endorsement. And this is what they found in London and Montreal, Canada, that there was insufficient political integration. So we acknowledge the high-level panel which are in this group from the parliament and of course the national bodies. And then again, when you look at the building resilience of our cities in this time of COVID, there is the urgency to develop policy coherence. So bringing in together the disaster risk reduction strategies, climate change adaptation, the sustainable development goals, of course, looking at all the targets. And of course, the other sectors have to be really brought on board. And of course, it's quite important at this juncture that we are focusing on gender later on. What are some of the policy lessons that you have learned so far in terms of the work that you have done, especially in Nairobi City? And when you look at some of the work that you have done, we initiated last year, we had His Excellency Honorable Governor Songo signing a research agreement, a memorandum of understanding to execute jointly a research study with the Tomorrow City researchers, and Dr. Johannes Atela, who is also present here, is leading the Nairobi Risk Up, and of course the coordinator of the whole study. And this one is a demonstration in terms of governments really coming forward, especially at the subnational level or county level, for instance, in Kenya, to really embrace research. And of course, we are engaging with the technical teams within the city, and the progress so far is really great. It's in linking up with the disaster management team led by Brian Kisali. And this one demonstrates that there is an urgency to really bring on board everyone. And of course, all the global frameworks, they're focused on no one should be left behind. Another key lesson is especially we need to focus on integrated policy approach in building the resilience of our African cities. And when you look at the policy outlook from the work that you have done so far. If you look at this slide on the left side, the lower side, there are 4 cycles. One cycle is focusing on global, one is on the continental, and the medium is national, and the lowest, the smallest is the city. So on these slides, above the line, we have the global and the national and the regional, and the below below the line, we have got the frameworks that are related to disaster management in Nairobi City County. So what does this demonstrate? Why we started looking at the policy work from 2010, especially for Nairobi, because it was a critical juncture for Kenya, where we had the cities and county governments being autonomous. And when we look at there is sufficient policy frameworks at the national and the regional level. But the question we need to ask ourselves, how are the subnational governments or county governments really performing in our cities? Because that is where the impact is expected to be felt more, so especially, and also to reach the local communities and of course the up and poor. And in 2013, Nairobi City acknowledged that it had low preparedness in terms of disaster. So for the honorable members and the stakeholders, you need to link it to the gender issue. But then we had some substantive work in 2015, where the Nairobi City promulgated the Emergency Management Act in 2015. And if you transition all the way to 2018 and 2019 actually is a critical juncture for Nairobi, because 10 sectors have already developed what you call standard operating procedures to support integration of DRR into the sectors. And of course, where we have the operationalization of the Mukuru special planning area. And of course, His Excellency the President brought in also 3 more informal settlements in Kenya. But then how are these cities or informal settlements going to leverage this particular city-based or national-based resources? Especially for Kenya, we have the disaster risk financing strategy, which was passed in 2019, which can unlock around 20 billion US dollars for Kenya. So we need to rethink in terms of engendering these processes, and of course, really empowering to leverage such resources. And of course, we had a discussion in the previous month this year in terms of what should be the vision for Nairobi City. And we brought different stakeholders, whereby if you look at these two graphs or 2 photos, on the left side, we have the current trajectory in terms of resilience, bringing in the government, the county government, and of course, the private sector. But when you look at the participants' desired city development trajectory and resilience, there is need to be strong collaboration between the government and the private sector. So it demonstrates that the way forward in terms of building resilience is that the private sector and the city government and the national government need to strengthen and of course bring in the community-based organization and the local communities. So in terms of meeting this vision, under the Urban Agenda for Nairobi, I picked this slide, this photo from the Urban Agenda for Kenya for 2016, which was passed in 2016. How can we achieve this kind of framework for the city where it's green, it's engendered, people with disabilities can really maneuver the cities, they can do their business, young people, old people, like other cities, we have got the green spaces, we have got also the trees, we have got the wildlife doing very well, but of course, those ones which are approved by the Kenya Wildlife Service. And there is need for an evidence-based planning and lesson learning that could inform more prepared future African resilient cities. So what are some of the lessons that we have learned in terms of response to COVID-19? Not forgetting the floods that actually killed more people initially in the course of the year than even COVID. What about the impact of other hazards like the fires that we have seen, of course, increasing, though there is also the air quality issues, the pollution. So what we need so far in closing this presentation is in terms of there is need for bringing on board all the sectors, everybody in the society. It tells us that, and we need to agree with His Excellency the President of Kenya when he said there's urgency maybe to review some of the policy framework. So there is a lot of work ahead of us in terms of really doing policy reviews, but of course, engendering this process. So I would like to hand over especially presenters and as of course the honorable members to really share with us what are some of the opportunities that you can have in parliament, at the county assembly, at the national institution, at the county government, and of course the CPOs who are present there, so that you can all go to work together in this process in preparing our cities and our societies for post-COVID-19. Thank you so much, and God bless you, and I'll welcome all the questions and comments from all the delegates. Thank you so much.
I intend to just talk in a few minutes just about gender and, you know, what is the best gender lens that one can use in disaster risk reduction. And in this case, we are trying to look at COVID-19 as a disaster, and we are trying to see how are we treating men and women, bearing in mind that both of them are two different, they have different experiences when it comes to disasters. And it is upon this, and as part of the Africa Research and Impact Network conference, to talk about gender, because gender is very central and it is one of those elements that we can say it is intersectional. It cuts across all issues, and especially during this COVID time. And one may ask then, what is ARIN? ARIN is actually in full, it's African Research and Impact Network that offers a platform for researchers to come together and try to harness their research prowess so that they can, in Africa, we can have some kind of unified voice to represent our research priorities. And we aim, as ARIN, we aim at trying to foster connections and peer learning amongst the researchers from Africa. And this ARIN, it has connected a network of scholars across and beyond Africa in various disciplines. The thematic focus for ARIN is really, in Africa, we're always looking at sustainable development. We want to look at climate change, cities and resilience. We're looking at trade and industry and technology. And if you look at some of the analytical approaches that ARIN is using, is that we can achieve these goals through research, policy analysis. That's why we've had a presentation on policy. And our goal is to try and transform research and policy for sustainable development in Africa. And so basically that is what ARIN is all about. And we are so happy because this is our first conference. And we are happy that Dr. John Tatela has been able to, you know, start out this in a very vibrant way. Now ARIN has about 50 fellows, and we are happy to hold this forum and for all of you to join us as we make Africa great again. If you look at this picture there, you can see people pulling, I could call them some kind of luggage. If you see, there are men and women there, but if you look at the lady there, she seems to be carrying more luggage than her counterparts. And indeed, we are going to realize that is exactly what has happened with COVID. You find that the effect has been disproportionate in the fact that men and women are experiencing this problem differently, as we are going to see. Today, the world is, I could call it hazard prone, in the sense that one hazard cascades to another, and then it brings on a chain of events. And right now, with COVID, we can see how risks have actually been laid bare. And it is correct to note that gender equality gains, whichever gains that might have been made, they have been eroded. Consequently, we are going to notice that vulnerability has intensified, where the poor, the marginalized, the aged, the disabled, men and women, boys and girls, communities, they are bearing these blunts. And when we look at the Sendai Framework Monitor, some of the records it presents are very sad to say.
Yeah, but I think Asenat was trying to highlight actually some of the gender impacts of COVID from economic, health, and income, and gender-based violence. And I think it was yesterday when I read in an article that the gender-based violence actually has increased in the informal settlements, and of course across the different regions. So in terms of a call to action, I think most of the institutions and agencies have actually responded. And of course, for instance, the UN agencies have responded, the African Union, the national governments, of course, they've been very proactive. And now for the case of like Kenya, where we have the county governments that are being called upon to respond to COVID, either by increasing the beds for and isolation centers and really other institutions being called upon to manage, especially provide psychological support, and government rolling out like programs on for youth, like vijana, youth being paid to work, you know, and also supporting the small and medium enterprises. So I think Daktari was, that was the last slide in terms of now how can we transition to mobilize or all the institutions, build synergy in a more integrated manner. And of course, from my perspective, is engendering the policy processes that can respond to not only COVID, but future pandemics and of course, multiple hazards and risks that will occur at the same time, and considering also the expansion of our urban systems across Africa. Yeah, Honorable Esther Passaris, please welcome, Mheshimiwa.
Oh.
All right, good afternoon, everyone. Okay, so basically, I'm going to talk both as a legislator and as a woman living in the capital city who has seen the impact of COVID, not just on me as a legislator, serving a constituency of serving the county of Nairobi. So what I want to say is there are so many things that went wrong in the beginning. You know, people, their freedoms, you know, the freedoms, that freedom to be able to move from one place to another, to be able to enjoy your lives in the evening after a hard day's work. When freedoms are curtailed, obviously people become emotionally unstable. And the biggest problem was we were not used to that. We've been used to curfews when we have political tension, for instance. But here you are, all of a sudden, you're not able to go to work. You're not able to, you know, when you look at people who work in bars and restaurants, most of them were shut down. Children were not able to go to schools. So this became a bit difficult even for families who were probably working mothers. Now your children are at home. And then, of course, job cuts because the supply chain was affected. So a lot of production had to cease. Then you're coming up with things like wearing a mask. We're learning to, it's a new norm now to wear a mask, to not greet hands. We're very hospitable people. So there's the psychological impact of this pandemic on people. And the psychological impact means that we as a country should have realized that we don't have the capacity to deal with already existing psychological issues. And mental health is on the rise. So COVID has made it even more serious. Then, of course, access to medical care. We have NHIF and we have our public hospitals. But we came to a point where now even the minister saying that NHIF will not cover COVID, it's actually made a lot of people feel insecure. Now, when I talk about this, we have men, women, boys and girls all impacted. So the pandemic, why is it having a focus on women? Because first, we've got a lot of single parenting. And single parenting means women are breadwinners. We've got a lot of single mothers. We've got a lot of widows. Then we also have a situation where women were being, those in matrimonial homes, right, were being violated either sexually or you know, there was domestic violence going on, and this was world over. We also saw a number of teenage pregnancies, a number of cases of defilement. So children being at home, maybe the parents, the mothers would not be able to care for them if they were still going to work. The children were defiled. We've seen a lot of girls getting pregnant, and that should tell us something. You know, we've always thought that the children get pregnant when they're in school, but now we realize that they also get pregnant when they're at home. So these are society's challenges that we have that we need to deal with. And at the same time, we also saw that quite a number of government initiatives like providing water tanks. In Nairobi, over 100 boreholes were sunk so that people could have clean water, because you cannot talk about washing hands, sanitizing, high hygiene. And that saw a drop in a lot of waterborne diseases. So it shows us that if we actually streamline our water, we will be able to deal with a lot of other ailments. But then there are also other areas where people suffered, in the sense that, you have other hospitals were only at that point only looking for corona patients to admit. And you find that also in Europe, all other surgeries are suspended. Everything is on focus on corona. So you find that a lot of people that had cancer, diabetics, that could not get their meds, and then also without an income, their meds, they could not afford to get their medical prescriptions. So that in itself led to a problem. We did have interventions with government in terms of water, sanitizers, and masks, but it was not enough. We had interventions in terms of the task force and giving food, but again, it wasn't enough. Private sector did step up, as they always do. But all in all, I feel that we should not lose the gains that we've had on the SDGs. We were already behind on the MDGs. We had this as the 17 Sustainable Development Goals. And now we have to take wind of what do we need to do in terms of not only dealing with the pandemic as it is right now and the interventions needed for the pandemic, but also how do we get back on track in terms of the SDGs. And then also the government has its agenda in terms of housing, in terms of manufacturing, to create more jobs, and in terms of food security and universal healthcare. So, a lot of people, expect so much. And of course, corruption has always been on the fore. And, corruption has a direct impact on poverty. And it's become a frustration for a lot of Kenyans when they think a lot of their resources are wasted, because then they see them missing out on benefits that they expect from their state. There's one area that we also need to talk, reproductive health rights, because if we had act together in terms of reproductive health rights, we'll be able to deal with issues of the pandemic much better, because we saw a surge in pregnancies, so women were not able to access family planning measures and birth control. And every country, to be able to maximize on its resources, needs to have family planning, because children have to be planned, populations have to be planned. And if much as you have the freedom of right to have a child when you want to have a child, the fact is a lot of women are having children either because of lack of family planning knowledge or commodities, and at the same time because they're raped. And then of course our reproductive health rights do not allow for abortion, and in some cases we've not released the guidelines. So in some cases women end up having children that they don't want, and we end up with a vicious cycle of wrong. We've also seen an influx right now of street children coming out because families are sending them out to beg because there is no income at home. So we need structures, we need safe houses, we need shelters for the mentally challenged, we need shelters for the emerging number of street children, we need drug and alcohol, substance abuse interventions. And basically, as a society, we need to realize that your government can do only so much, but we ourselves have a moral obligation to also look out for ourselves and look out for our loved ones. The frustration that I see the CS having every time he talks to us about COVID and the importance of wearing masks, we're still not getting it, that it's important to wear a mask, it's important to social distance, it's important to safeguard not just your family, but also the people that you work with or the people that you interact with. But all in all, I mean, the pandemic has brought to the fore what was already existing that we were not tackling very well. We have a dependency with our CSOs on donor funding. We saw quite a number of donor funds being suspended or withdrawn because they were also dealing with issues in their own countries. So as a country, government has to find a way to also support the very, very many civil society organizations that are doing very, very good work. And we also have to look into our orphanages. Right now, we have a big scandal going on about the theft of children from very vulnerable citizens and selling of children. So again, that requires structures. Not everybody should run an orphanage or a children's home. And hospitals need to have really, really strict processes that make sure that there are no loopholes where a child can be stolen and sold. Because again, that we don't know, it's sad to think that a child was stolen, whether from the streets or from a hospital bed, and their parts are going to be used for witchcraft, or in this day and age, or they're going to be sold, boys getting 80,000, girls being sold for 50,000. It's very, very painful, because a woman who has a child and cannot look after the child should be given the support to look after the child, not the child taken from her and sold. So it looks gloom, but at the end of the day, as long as we're alive, we have what it takes to do what is right for our country and the world over to move forward. Thank you.
Yes, thank you so much, Mheshimiwa. Thank you for highlighting and especially responding to those two questions, highlighting the different impacts associated with the COVID in the city and some of the initiatives. So during the question and answer session, I'll be very happy and to join the colleagues or delegates to really ask you some of the key questions. But some of the questions, 2, 3 that you can prepare for is that how can we really secure the gains we have achieved so far based on the strategies that you have shared, considering the limitations that we have as a continent also in terms of resources and capacity. And then secondly, in terms of resources, funding, donor funding being limited now, they're responding different, countries are responding differently, and they are also constrained in terms of resources. And for the case of Kenya, Kenya being the first country in Africa to really develop the disaster finance strategy and to unlock 20 billion USD from the World Bank to support disaster management. How prepared or how can we prepare? What are some of the strategies to leverage this finance to the most vulnerable, the vulnerable groups that you have mentioned, people in the streets, young children who are vulnerable to gender, to early pregnancy, and of course, the gender violence victims in the city.
Asante sana, Esther, for coming and for that wonderful presentation. Well, I think next we are going to hear from Tatiana Mzozo, who will give us the World Health perspectives and some of the questions she's going to talk about, given that World Health Organization deals with the SDG 3 that tries to look at healthy lives, and SDG 5 on gender equality. I could like Tatiana to tell us something about how does COVID, actually, how has COVID revealed the gender disparities and inequalities when it comes to the healthcare workforce? And then, of course, she's going to tell us from the World Health perspectives, what is exactly is World Health Organization doing? What are some of the interventions that are being done to address this very evident gender disparity or gender equality gains that are being lost so far? Welcome, Tatiana.
Thank you so much, Dr. Asanath, and I'd like to recognize all the honorable members in the House. Thank you so much. I'll show my face for a minute and then get off the video just for the purposes of ensuring I'm able to make my presentation. Try to share my screen. Okay. I think you can see my my screen now. Okay, so I'm going to talk about gender and COVID-19 in the Afro region. Occasionally, I will give examples from countries in the sub-region, East and Southern Africa, as well as mention a bit of the global situation, but not so much. In terms of the Afro region, first of all, if you look at the COVID-19 pandemic, generally more males have been affected since the beginning of the pandemic. However, if you look at how the pandemic has progressed, especially in Africa, you see an almost equal distribution in the current data. And this is not to say the situation is the same in every country. You will find that there are variations from one country to another, and there's need for a deeper analysis by country. Many people have tried to explain this through biological factors, hormones, and so on, as well as socioeconomic factors. I think it's an area that really needs research. If you look at this is the curve, the epic curve from the beginning of the pandemic to about September. You see that the distribution of the cases, I don't know if you can see my cursor, is this blue or green? Shows that more males are affected. This is the current data, maybe the latest from 15th of October. You see that from the right of the screen, about 51% of male and about 49% of males are affected. As I said, there are country variations. South Africa has more females than males that are affected, but if you look at the rest of the region, it's mainly males that are affected. This is an example from Kenya. Again, from Kenya, you see that we have more males that are affected than females. However, if you look at the testing data, you find that more males are testing vis-a-vis females. But if you look at the positivity rate, that is how many people turn positive out of the sample that is taken, more females are actually turning positive. So we have a higher rate within the females. So that masks or unmasks the disparities amongst the testing. Of course, there are many questions related to gender there. Is it because they have more males have more information? Are they traveling more? Are they more engaged in work that is paid, and so on and so forth? Again, another area for research. This is from Malawi, again showing disparities, variations between countries. You see that most of the cases are aged between 20 and 49, and 68% mainly males, 67% of cases amongst males, and also the deaths are attending to that. This is from Zimbabwe. You see from Zimbabwe, about 51% of the known cases to be female. So how has the pandemic really affected the essential health services? The health system was already overburdened by whatever issues we were facing in Africa. And then when we had the pandemic, of course, we had an even higher burden that the health systems had to deal with. The first 3 months, of course, saw public health measures such as lockdowns, travel restrictions, repurposing of facilities for COVID-19. And on top of that, we had ongoing floods, drought, food insecurity, other epidemic-prone diseases such as cholera and measles, and many others that you can mention that were ongoing. So this came on top of that. Now, if you look at this next kind of table or graph, you see that there are quite a number of services that were affected. If you look at maternal and newborn health, immunization, child health, nutrition, reproductive health, especially this side of the screen, you find that these are issues that mainly affect women. And you see quite many of those were actually affected, and therefore we say that during emergencies and disasters, women and girls are generally, and I use the word generally very loosely, affected. And we have evidence from previous outbreaks and pandemic influenza, as well as Ebola, that shows that women have been more affected, as well as other natural hazards like floods and drought. However, acting on the pledge that we need to leave no one behind, there's importance of integrating gender issues, particularly if you remember that health is an outcome of so many social determinants. So why are gender issues important to consider? We have existing, especially for the pandemic, we have already existing gender-based inequalities and specific and combined vulnerabilities amongst women and men, girls and boys, and many other groups, LGBTI and so on, that you can mention. There's also unequal access to information and early warnings. How are we presenting the information to women? How are we presenting it to men? Are we taking into account the literacy levels, for example? We also have varying national capacities and experiences. Some countries have already had experiences with some diseases. Example, DRC has had about 9 or more outbreaks of Ebola. Their capacities cannot be the same with a country that is basically dealing with a huge outbreak for the first time. Again, you see that we have different needs and within different populations. For example, if you take into account the issues of migrants that are moving across borders and how many women are in there and how many men are in there, I think it is quite important to take into account that. We are saying because health is a conglomerate of so many social determinants, it's important that we discuss gender responsive approaches to health issues, because research has highlighted that health emergencies and disasters affect different populations quite differently, and based on the demographics of our community, it could be a very varied response that you're talking about. And then a failure to address gender will definitely reduce the efficacy of health emergency and disaster response, then, because you're not taking care of everybody and therefore you're not responding to the call to leaving nobody behind. I will not present the data because I just didn't put it in view of the 15 minutes that I had, but we have reports of violence against women and children increasing during the lockdowns. You've had media reports of increased pregnancies and so on. Access to sexual and reproductive health and rights for women and girls may also be reduced during the pandemic. We have seen some of this through the slides that I have provided. Health and social workers have also felt increased vulnerability. You can see that various countries, we have had strikes because healthcare workers have been advocating for rights such as provision of health for themselves and being covered. And 70% of these health workers globally are women. There's also increased stigma and discrimination occurring and hampering effective response. I'm sorry if I'm going too fast. I'm just conscious of the time that we have. So what are the key considerations for gender in health emergency and disaster response? We are talking about gender equality at the institutional level. Are we able to put in place policies and programs that support gender and mainstream and integrate gender in COVID-19 response? Women, for example, able to take up leadership positions in the COVID response. Also understanding the context of health emergencies and disaster. How many women are affected? How many men are affected? So disaggregating the gender statistics to make sure that we are addressing the impacts to both men and women. Ensuring also a participatory approach. Who communicates what about the pandemic? I think there's somebody who has the mic on. If you could kindly switch off your mic. Protecting and addressing gender-specific needs. As I said, maternal and newborn health, for example, this is an area that is quite affected. In terms of research, I have mentioned some previous research in Ebola and other pandemics, but we are seeing that we have very limited data on sex and age disaggregated basis. And this is really hampering analysis of gendered implications of COVID-19. So it's an area that I leave to ARIN and other colleagues who might be interested to work on. A bit of WHO actions. We have been working on guidance development. There are so many guidances that WHO has issued for the pandemic. If you go to the WHO website, www.who.int, you will be able to see all of them there. But I want to point out specifically the continuity of essential health services across gender and vulnerable populations. This talks about just ensuring continuity of health services through to the community level. Gender disaggregated surveillance and analysis, I have already talked about. Encouraging women leadership in health emergencies. We're also providing guidance and technical assistance to member states on protecting and addressing gender-specific needs, and also collaborating with academia on conducting research on the virus dynamics, including gender of the COVID pandemic. We have a strategy for disaster risk management within WHO in the Afro region. It is very well aligned with the vision and goal of the Sendai Framework, and it basically looks to provide, identify and assign responsibility and equipping DRM units within MOH, establish functional health sector subcommittees in national platforms, again, conducting risk analysis and mapping from the health perspective, ensuring preparedness planning, and also incorporating emergency and disaster early warning. Of course, the targets are stated on the middle panel, and that is how it looks like on the right. I'm going to kind of finish by sharing two-pronged approaches that we use. One is for institutional capacity, where we are addressing the disaster risk management through the cycle before, during, and after a disaster, and also for individual competency building for all health professionals. So we provide guidelines, as I've said, for capacity assessment, for emergency response, and also for national health transition and recovery. On the right, you see a few of the tools that we use: capacity assessment, core competencies, risk recovery, SOPs, vulnerability risk assessment, and health sector health safety analysis. We have on the global program of work, ongoing actions, that is hazard emergency preparedness and capacity assessment, capacity to address sexual and reproductive health and MNH, maternal and new health, and older persons in fragile humanitarian and emergency settings. We also support operational readiness and capacity assessments for the countries to be able to support them to just increase their capacities through addressing the pandemic. We also specifically, let me mention this one because it is related to COVID, have a plan for pandemic influenza preparedness and response, which we have had even before COVID-19. We have continued to use that, and we are doing many other things, including training of health workers. We have an ongoing training right now on case management for health professionals who are dealing with the critical cases of COVID. And then we're trying to generate evidence on high threat health hazards, supported, of course, with academia and other networks, and so on and so forth. So in view of time, I would beg to stop here so that I don't take too much time and monopolize, and I'd be happy to address some of the questions that might come up during the session. Thank you so much.
Thank you very much. So in the interest of time, I'm going to invite also Matthew to also talk to us before we can open the floor for questions and answers. Matthew, you're most welcome.
Thank you, Asnat, for giving the opportunity and inviting me to be part of this important discussion. I feel that that is the challenge of being the last person to speak, especially when some of these issues actually cross-cut different countries and nations. The responsibility, or what I'm supposed to be speaking about, especially the impact of COVID-19 on gender issues in diaspora, I feel they have already been touched on, and my fellow panelists have actually spoken to them. Probably what is different is the approaches that different nations, especially in diaspora and Africa, have responded to these gender issues and to find a way of dealing with them. That might be the major different things. Otherwise, all the issues you have raised are also issues that are in the diaspora. But just for the sake of emphasis, I would also like to add my voice. And I want to start with health. When you look at the impact of the virus, already it's a health pandemic. And for that matter, it makes a very huge impact on human beings, both males and females. But you get to realize that for the time being, more males are affected in terms of ill health as compared to women. We are not yet certain why this is the case. But I guess there's need for more research to be able to find out why that is the case. But when it comes to social and economic impact, you would realize that more women are impacted as compared to men. But some researchers have attempted to make some suggestions or some proposals as to why, when it comes to those who are actually impacted in terms of their health, more men are. And one of them actually suggested that it's possible that men already have conditions that predispose them to the pandemic. And when they actually get affected, then it progresses to admissions and death even in the hospitals. And if you look at from European countries, World Health Organization has reported that men account for 57% of deaths emanating from COVID-19, and 70% of admissions to the intensive care unit are also men as well. So you realize that there's that kind of higher propensity of men to die as a result of COVID-19 and to also be admitted as COVID-19 as compared to women. And if we cite example from Netherlands, you will notice that 38% of confirmed cases, and that was until April last year, were actually men. And this was more than what women were actually facing. So what I'm actually saying is that out of the 55 countries that were able to provide sex disaggregated data to World Health Organization, it actually showed that males were more likely to die and getting admitted to hospitals as compared to females. That is the point I'm just making there. We also noticed that in terms of exposure to COVID-19, women are more likely to be exposed because of their responsibilities and the roles that they do. In the health sector, women are likely to be more or higher in care roles as nurses and many others. And these are frontline fighters of the disease. So by the mere fact that they are working in those spaces, they are more exposed to the pandemic as compared to males who are not as many as compared to them in that space. So that is something that has also taken a gender lens that we need to look at. Another thing that we need to look at is that because of COVID-19, a lot of priority has been shifted and resources have been shifted to COVID-19. What that means that other aspects of health are going to suffer, and services that were mostly accessed by women, such as those who seek family planning services, abortion services, contraceptives, they have suffered. And because more attention was paid to the virus, and that meant that these areas are suffered. And since women are those who mostly access these services, they are more impacted in that as well. And the Mary Stroop International, which actually researches into this, actually projected that 9.5 million girls and women around the world are likely to be cut off from this kind of services. Another thing is because women actually have the care responsibility of their children and themselves, due to the fear that people who are infested likely go to hospital, then people are now getting afraid to themselves, move to the hospital, and they therefore have to suffer taking care of these children and themselves at home without actually accessing medical attention because of the fear that if they get to these hospital spaces, they might also get infested. So these are some of the health impact of COVID-19, which has actually taken gender dimensions that we have to take care of. In terms of economic activities, as I did mention that when it comes to real impact in terms of social economy, then more women are impacted as compared to men. Yes, there are some men who are also being impacted, but in comparative terms, more women are actually impacted than women. And that is for the simple reason that the kind of activities that women do actually predispose them to that. A lot of women are employed in the informal sector, and it is estimated that 740 million women are actually employed in this sector. With the introduction of lockdowns, what that means that all these jobs have disappeared because people were not allowed to move out to engage in these activities. And some of these activities, you couldn't do them working from home. So what that actually meant is that all these jobs are diminished or have disappeared. And what that also means that people who are in these roles have also lost their jobs. So what then happens to how they're going to take care of themselves, how they're going to take care of their rent, food, and many other things. So that's a real impact that we have to look at in that sector. We also find women actually working in what we call the retail industries, smallholder farmers, tourism, travel industries, and all these jobs were actually closed during the pandemic, especially during the lockdowns. And that actually meant that they lost their jobs. And if they lost their jobs, they have lost their source of livelihood and all those who also depend on them. So that is something that is also very important to actually highlight. I think an example that I wanted to cite is that a report by Institute for Fiscal Studies found that mothers in UK were 1.5 times more likely to lose their jobs as compared to fathers during the lockdown. And that has real impact. Another thing when it comes to economy and impact is that as we went to lockdown, schools were closed. It means women were taking more responsibility, care responsibility at home. And as we already know, some of these activities are unpaid labor, and women had to shoulder that responsibility. Before close down, schools were open and teachers, care workers at school needed to take care of that. But because it was now closed, women were now taking care of that at home. And that is a kind of unpaid labor. Yes, so that's what I want to talk about economy. There are many things, but because of time, I would love to move to other things. When it comes to relationships, abuse, and violence, what has actually been noticed is that there's increased violence activities at homes. And what has also come out is that, yes, both men and women can be abused. But the data that is actually available show that more women are abused at homes and more women and children. And my earlier colleagues already highlighted that. So that is more important for us to highlight. And I'd like to cite an example from UN, which by April 2020 actually said that there was an increase, and the largest UK, for example, had 700% increase in calls from women who were predisposed to domestic violence issues. So that is also something that we need to take care of or be aware of. Now, the next thing I'd like to talk about is women leadership and representation when it comes to these issues. And you again realize that it has taken gender lens. And that's not surprising, because if you look at in a lot of countries, even in the diaspora, most of the leadership positions, presidential, prime minister, they're occupied by men. And for that matter, even that status in itself gives men some leverage to be able to make decisions for women. And the lack of voice or the inadequate representation of women in these spaces actually mean that the decisions, the plans, the policies that are going to be made might not actually favor women, because you get people speaking for them. So when it comes to recommendation, I think it is important for us to realize that we need people, diversified people in these spaces to actually represent themselves and speak for themselves. And that is the only way we can get to a level playing ground where people's concerns can actually be addressed. So these are some of the major issues that diasporan impact of COVID-19 has. What are some of my proposals as a way of dealing with these issues? I think I've already mentioned some, but a start point is that we need equal representation of women in these spaces, in this decision-making process, in these decision platforms. And there, their interests, their concerns, their experiences will be impacted or affected in terms of what policies that will be made to address the issue. I also think that we need to have a transformative change for equality by addressing the care economy, paid and unpaid jobs. If we have forgotten, one of the things that we have to remember is to rethink about some of these responsibilities and roles. What does that mean to say an unpaid labor? Who are those who are in the care sector? And what is the pay disparity when it comes to people who are engaged in these spaces? That is something that we have to consider. And that is something that COVID-19 has given to us to reconsider. These issues are not new, but I think that COVID-19 is just making it more apparent, and we need to rethink about it. So coming out of COVID-19 and post-COVID-19, I think if for nothing at all, we have to have a clearer picture of what we need to do to bring equality to people who are engaged in this sector. So these are three proposals that I would make. But when it comes to real actions, what are some of the countries in the West, in diaspora, what are they doing? I think I start with Australia, where I'm kind of resident at the moment. And one of the things they actually did was to provide a $150 million facility to help in the national plan to reduce violence against women and children at home. Yes, so that is in response to the increased number of people who are going through violence at home. So this amount of money is made available and given to various institutions that are already in this space to help in that. I think another place is 4 women in Australia have actually gained a grant or grants, different types of grants to actually research, to actually see that what do women need in this moment and how can we address these things? Because before any feasible policy can be made, it needs to emerge from data, it needs to emerge from research, and that particular is very important. Another strategy that the Australian government has actually put in place is what we call e-safety commissions resource for women. In terms of violence and abuse, most of these women, most of these children actually live with their abusers. So how can they actually report these issues when they are not able to leave, when they are stuck at home with them? So they actually have an e-resource center where they've given strategies as how to go about this thing without exposing yourself to your abuser who lives with you at home. And I actually went through it and I saw it's a very helpful tool to actually engage. Another thing that I want to say that actually goes to cement the importance of women in decision making is that if you look, there's not yet a conclusive evidence that this is the case, but if you look at in the West, countries that are led by women have had good management strategies as compared to countries that are actually led by men. What does this tell us? Even though the evidence are still anecdotal, we need to rethink about this, that the strategies that these women leaders actually adapt, is it because they are women? Is there something different about the countries? Yes, some people have actually done a comparative analysis and they actually compare some of the countries in terms of their size, their demographic, and the kind of governance system. And it's actually still emerging that countries led by women are more in charge or in control of COVID-19 cases as compared to countries led by men. And one of the examples that I will give is that at the start, some men did not actually believe that COVID-19 was real. And the Prime Minister of UK actually said he went shaking people in a hospital. But what happened is that at the end, he got affected. He did not believe it. So that's something that we need to take key note. I think another strategy that Australia is actually putting in place in terms of the gender space is that what we call the job seeker stipend and job seeker stipend. We know people are losing their jobs. So Australia has put in a stipend that people who have lost their jobs can access through Centrelink. And people, another set of money has actually been given to organizations that are likely to have let their staff go because of a lack of resources, lack of money to pay them, so that they are still employed and government actually gives them stipend to take care of that. I think another important, and that is good because if a lot of people that we are seeing are losing their jobs are actually women who are getting home without any, then this kind of stipends is actually a very good place to start with, and it's actually very helpful. Another important strategy that Australian government has actually put in place is that no landlord can or landlady can evict their tenant just because they don't have money to pay their rent. And the government it's a policy that the government has put in place. So it means if you're not even working and you don't have money to pay your rent, at least you are guaranteed a space to stay. If you also think you want to still continue paying, but you don't have up to what you usually pay, based because you have lost your job, then you can negotiate with your landlady or landlord to reduce the cost. And that is a policy as well. And within this space of time that we are still battling with COVID-19, the government has actually ensured that no landlord or landlady can evict a tenant for whatever the reasons. So that is something that is taken care of. Taking into considerations of these strategies in addressing COVID-19, the impact of COVID-19, what is actually some of the challenges that we are still facing? Some of the challenges that we are still facing is that there's still inadequate data, which is actually not disaggregated based on what gender. A few countries have actually been able to gather that data, but a lot of countries do not provide. So it's high time we started looking at that data and see what kind of analysis that we can actually make from that data. I think another challenge that we are facing now, which as I was speaking, it will be taken for granted that everyone, women and men in the West or in diaspora are getting access to these services. No, undocumented migrants are unable to get these services because first and foremost, their status and living in those countries are questioned. So they remain hidden, and they are those who receive the impact of these services of COVID-19. Another thing that we have to also take into consideration is that anyone who has ever been in the diaspora, there are a lot of homeless people. When we have stay at home, where do those people go? We have an assumption that everybody has a home to go, but not everybody actually has a home to go. And these are the most vulnerable people. And I wonder whether in making these strategies, those people's needs were also taken care of. Well, I can't tell because I was locked down at home, so I couldn't go to the city to see homeless people who stayed on the street. What happened to them? Maybe that's something that we have to look at in the future. I think another thing that we have to also look at is if you look at countries such as US, people who were already do not have access to health facilities because they could not pay for their health insurance, other things, it actually deepened. And these people actually died as a result of COVID-19 more than any other population. So COVID-19 again has come to actually point to us that these disparities in society are still living with us. Looking at my presentation, I want to end and of the presentation from my previous, my colleagues. One of the things that you will look at or you will observe is that all of us, our attention has been focused on mainstream support, what governments are doing and what formal organizations are doing to help address or minimize the impact of these people or COVID-19 on vulnerable group of people, men and women, people with disabilities and migrants and those kind of things. But as an expert, one of the aspects in disaster management and risk recovery and building resilience, Daniel Offridge would tell us. He would go to make a point that in terms of disaster, resilience, and recovery, the most important resource is social networks that people have. So in this case, I think it is important that we begin to acknowledge informal networks that people who are impacted by COVID-19 have made on their relatives, on their friends who were actually impacted. The first group of people or individuals who will be there for you are your families or your friends. Even if you are lonely and stuck at home, there are those that you are going to make a call, and that helps in your emotional healing. If you don't have money before government even begin to process, because sometimes when government makes announcements, it takes a while to be able to operationalize that. Friends, family, your network, religious people are the first group of people who are there to support you. You know, so it's very important, and we have also seen that in terms of building resilience, people who are exposed to social networks are more prone to getting, to have resilient and recover as compared to people who do not have. So people who are academics, who are, or policy makers who are in this space, we have to turn our gaze to see how these people are actually helping out. Thank you so much.
Well, Matthew, that was a very interesting presentation right there, giving diaspora perspectives. And I think I like more when you talked about the e-safety resource centers that have been set up to address some of the COVID sufferings that are happening right there. So, and then of course the health impact and the responsiveness that has gender lens, that is just amazing. And thank you very much. I don't know if we have Rachana. Rachana is from Kathmandu, Nepal. She had a unique case that she was to share with us on Nepal. Okay, if Rachana is not with us, I'll quickly just show through some of the, I thought, very interesting experiences that she shared from Nepal on how COVID is. And generally speaking, it is to do with most of the things that we've talked about on lack of gender disaggregated data, issues to do with gender-based violence, income and livelihood have been lost during this time, and unpaid care. I think Honorable Pasaris mentioned this, also Matthew and Tatiana, and also Rachana gave a case of where women have lost their small enterprises, exactly what is happening here in Kenya, where the informal sector is the one that has been hard hit during this period. And also, of course, again, gender-based violence that has been on the rise because, of course, now partners get to be together because of lockdowns, and so cases are very high in Nepal, and that has also been shared. And also the lack of inclusive DRR governance. I think that is something that Honorable Pasaris could tell us exactly how can we improve governance when it comes to taking care of men and women, when it comes to the differentiated needs when it comes to disasters. Even during COVID, the experiences are quite varied and different for each of them. So how best can we address that? So that is really the short case from Nepal, and I'm happy to present it on behalf of Rachana, who has not been able to join us. And so then I want to move this session to question and answer, and Washira is going to check out on our chat to see if we have any burning questions there that we could address them to our panelists. Washira, please.
Thanks, Dr. Asenad. Yeah, we've got some comments and questions. Good enough, I can see our panelists and the participants are already engaging. But I'll pick those ones that perhaps have not been addressed bilaterally with between the participants and the panelists. And the first one comes from Joel Onyango, and this is directed particularly to Charles, who took us through the policy arena. And Joel suggests that it would be interesting to look at the urban agenda, the disasters experience, and COVID. Which has the so that we can be able to see which has the most impact on the need for gender mainstreaming and how collectively they can affect the mainstreaming. Then there is a question from Mugo is asking whether we can share the presentation, and for sure we are going to share the report. And then we've got Winnie. Winnie is saying that there is need to think broadly about gendered impacts and customized solutions that promote equality beyond the pandemic. I think that's based on the fact that we are seeing a lot of these responses directly being directed to COVID-19, yet we see, as the panelists are arguing, this is really, COVID has just come to, aggravate the situation that we have. So the question, I think, from Winnie is how can we, integrate this beyond COVID-19? And I believe that is open to any of the panelists. Then Dr. Johannes, there's key lessons from Australia there in terms of social safety nets. So I think that's also a comment. Yeah, so members, you could keep the questions coming through the chat, and perhaps Charles, you could respond to question by Joel, and any of the panelists could feel free to respond to Winnie's question on how we can customize solutions to promote equality beyond the pandemic.
Okay, thank you so much, Washira. As Charles responds to that, I'm going to pick one from Haron. Haron is asking this to Honorable Pasaris, and the question is, what are Mheshimiwa, what are some of the lessons that we can learn and adopt for Kenya, especially for the urban poor? I mean, and then of course, there's another one that same to Mheshimiwa. It says, how can a bottom-up approach inform county and national level governance. Yes.
Okay, first of all, during the pandemic, we had a task force as well, and all ministries are somehow interlinked and connected with ministries all over the world. That's a given. So you share experiences. Even for instance, our KEMRI is working with international bodies on how best to come up with vaccine solutions. In our responses, World Health Organizations, we're all members, so we all come up with the same kind of solutions. In terms of the SDGs, we also have the UN office here. We have connections through World Bank. So when it comes to integrated approach, of course, or learning from bigger economies, I think every country will take note of what's going on and see how it can be factored into their own agenda or their own programs. So what I can tell you is Kenya was quite ahead in terms of the social interventions. For instance, the National Affirmative Action Fund, trying to get not more than 2/3 of one gender in parliament. That National Affirmative Action Fund was actually for grassroots to ensure that we can empower the grassroots in terms of their saving culture, in terms of their projects, in terms of assistance in bursaries, etc. We already had something called Kazi Mtaani, where you try and give the youth jobs to do, so that they also feel part and parcel of the solution. And the job that they were given is, let's clean up the estates, because with COVID, we need hygiene to be of paramount, very, very good. We had cash transfers in Inua Jamii, giving cash transfers to the old, giving cash transfers to the persons with disability. So government has had quite a number of interventions. And the whole agenda of the government in terms of upgrading the slums, in terms of housing, all right? Obviously, it's still ongoing. The programs are still ongoing. But COVID, of course, requires that you will take quite a lot of money to boost up the health sector in this period of the pandemic. And other programs might be delayed, but not shelved. We also report on the SDGs, and obviously, when you have the SDGs, you're looking at all areas. The president was recently in Mombasa to launch a big fish processing plant. That's, of course, again, trying to see how Kenya can position itself to become food sufficient, to also become a huge exporter, to become a manufacturer. So we have programs that are ongoing, but I feel like in Nairobi, one of the areas that we failed in, and the gender ministry needs to do a lot more, is in safe houses. And the relationship between the Nairobi County and the NMS has obviously been a bit of confusion. So there are bottlenecks and problems that occur in a country. But I looked at the Australian policy where if you couldn't pay your rent, you didn't have to pay. You could have some window, or if you wanted to negotiate with your landlord. Here in Kenya, we had the fantastic landlords who said, don't pay rent for the next 3 months, or we're cutting your rent to 50%. And then we had the not so fantastic landlords who locked their tenants in with padlocks until the rent was paid for them to be released. So, every country will have to deal with its problems on the best way that it knows. But I know that in Kenya, we've realized that we need a lot more shelters. We definitely need a lot more shelters and safe houses for people. And we also need to boost up our counseling to deal with mental health and emotional issues, because right now, suicides are also on the rise, and, mental health needs to be addressed. And I think, when you look at the social media platform, we see and we understand what's going on. So the populace in Kenya is an angry populace, and I feel that we need to spearhead the social media in such a manner that we can learn from each other and improve, rather than always at each other's throats in terms of just looking for everything that is wrong. Because there are a few things that are going right, and I believe that it's a work in progress, not just in Kenya. I mean, even in France, which is developed, you had a situation where you didn't have hospital beds. You couldn't give in the UK, you couldn't give everyone free testing. People had to pay for the testing. So it's a pandemic is a pandemic. We're living through a pandemic. It's not something that happens even in one's lifetime, and now we are actually living in a pandemic and dealing with issues that are not easy, not understandable. Every day is a new day. Right now, we had this. It was hard even to convince people that there is a pandemic. Everybody thought, oh, it's the government's way to get money. Now that they're losing loved ones and they're hearing about their neighbors dying, they're getting a bit more serious. Now the government has made wearing a face mask mandatory, or you will be fined. Of course, the populace feels, oh, why should we have to pay for the face mask? Why should we get it? But every nation, including a developed nation, even the best like the US, has limitations in resources. So we as a population from the bottom up should also take responsibility for being our brother and sister's keeper.
Wow, thank you very much, Esther, for those great comments on some of the interventions or exactly what can be done to make better, because one of the agendas we had for today is to try to build back better in terms of resilience and livelihoods. And really, it's amazing how you're always passionate about these things. We truly appreciate.
The question is, as your presentations have clearly shown, there is an upsurge of gender violence related to COVID-19. So that is what data is saying. So what does that exactly mean for a woman at the local level, at the grassroots? What does that mean to them? What do they need to do? What action do they need to take? What are the implications for them at the grassroots levels?
Yeah, that's a difficult question to ask somebody who is actually working at the regional level, who has not really been at Mashinani for a while now. But anyway,
absolutely, yeah.
Yeah, but
perhaps Honorable Pasaris could also come in. Thanks.
Yeah, what I think as partners we need to do though is put in place programs and policies that can protect the woman really who is at that local level. So if you are, for example, putting in place a shelter because somebody has been displaced by a disaster, or if you have to accommodate a patient and a caregiver is there at the hospital, how do you make sure that this person is actually safe while they are attending to the patient at the hospital, because most of them may not be able to sleep in the hospital. And then this woman could have left children back at home. What are the community social safety nets that we can provide to make sure that the girls and the boys that have been left at home are also safe? What about the visit hours and the walk from the house to the hospital, if at all you're going to see your patient, even though, I mean, we know that with COVID-19 that is quite restricted, but it is happening. So those are my few thoughts. I mean, it's really hard to put the burden on the woman. It is more of what can we all do to make sure that these women are also safe. The second thing I would quickly think about is really, how do we provide access to this woman in terms of just accessing PEP, for example, and taking into consideration that most people are stigmatized or feel afraid to go to the hospital because they think that when they go to hospital, they're going to come out with COVID. So how do you reassure the woman that, for you to be able to access this kind of support, you need to visit the health facility, and you are going to make sure that the infection prevention control measures are top notch, and you will not come out with an infection. But these also are the steps that you need to take to make sure that yourself, you are empowered enough to take care of your own infection prevention and control. So just quick thoughts, top of my head, and Honorable Pasaris, I think, can support in that area. So, sorry, I just remembered one more thing. Maybe the other thing would be community outreach from ourselves. So again, I'm removing the burden from the woman, because I don't think it's entirely up to her to be able to do anything about it, but it is also up to us as stakeholders and communities and members of the community to ensure, and service providers to ensure that we provide such a service, whether it is through community outreach and so on. Thank you.
Okay, first of all, I think government has quite a number of interventions, and I think one of the first things that government recognized is that we needed to be put in clusters. So in every what we call mashinani, in every informal settlement, you have clusters called the Nyumbakumi. And then you've got the administration where you've got the chiefs, and then you've got the CSOs, and then you've got, what do you call it, the groups themselves that have organized themselves. Not everybody's organized themselves into clusters, but generally there are clusters. And it is those clusters that we also fund. Like we rolled out quite a number of programs during the pandemic. We rolled out programs where we give youth groups posho meals where they can earn their income as well at the same time. So we're creating employment. We rolled out some laundry marts. We gave out saloonists. We gave them all their equipment so that they could actually run their saloons within their houses or go from house to house, because most of them had lost their jobs. So there are interventions, but they will. And when it comes to domestic violence, of course, there's the police. There's the we launched recently Polycare, where the police wants to have a one-stop shop. And under GAP, we're going to be funding some gender-based violence desks in 17 police stations. Limited resources means we can't do as much to impact everyone. So there will always be the cases where they feel they were let down by their government, they were not able to be assisted. But generally, the move is to ensure that we can capture as many people as possible who are victims of gender-based violence. And as I said, the CSOs are on the grassroots as well. Yesterday, I was at a function with the COVAP, the Coalition of Women Against Violence. So there are people on the grassroots. There's hotlines where you can call. There's the Wangu Kanja Foundation that also deals with abused women. The interventions are there, but to say that they will reach everyone that is in need would be a lie. The ideal position that we want to be as a country, we're not there yet. But the mere fact that we've started the journey means that we will be able to one day look back and say we're capturing everyone. The police has also opened a center where they hope to capture all the cases that are the violent cases that are being the criminal cases that are being reported. So that we can be able to see from reporting to execution, going online to resolving the case. From OB to resolving the case, what is the duration? So there are systems and structures being put in place to make sure that we manage everything that impacts people socially, way above and beyond the pandemic.
Are we evaluating the effectiveness of the policy and legislative frameworks that we have in place? And secondly, are these policy frameworks really building synergies? And that is from the Tomorrow City study that we are working in partnership with Nairobi City. That is the area also that we're really going to cover in terms of at the subnational level where the impact is expected and more action implementation is supposed to happen, is that we are going to call upon all of you, especially to support through the community of practice. We really evaluate the effectiveness of these national and subnational and city-based policy frameworks, and of course look at the synergies, because when you look at the response to the different disasters, including COVID, they are more of reactive and emergency, and really overwhelms the existing systems in place. Kennedy, I think, is a year from Homa Bay County government, and you looked at that 8% of the subnational governments have reported their strategies at the continental level. So that is actually below average and tells us that this need to support the subnational governments, and I call upon especially Honorable Esther Passaris and the county assembly members that really look forward, and of course WHO representative and other partners, we build synergy towards really supporting the subnational governments and local organizations who are really executing the response mechanism, but also at least predicting and engaging in action research. Thank you so much.
Oh, thank you, Charles. I now invite Dr. John Satella, who is the convener for Africa Research and Impact Network, to offer us the closing remarks. Welcome, Dr. John.
Thanks, Dr. Ari, and thanks everyone. I think mine is just to say a very big thank you to the panelists and the participants. I know we've gone over time, but just to appreciate your time and insights. I think this is a discussion that will need to be continued. Some of the issues being discussed are really very complex, as you realize that gender issues are really, has a lot of complexities that perhaps needs to be understood better. And in that understanding, we might need to really have collective, continuous dialogue and discussions so that everybody have, a particular common understanding of what some of these gender challenges exist, of course, within the current set of disasters, but also in the context of the future pandemics. Indeed, I think most of the speakers have reinforced the element that most of the key vulnerabilities are on women, which I do agree with fully. And these vulnerabilities which women have been actually suffering have been kind of reinforced by the COVID situation. We do agree with that, and that is a clear fact. But perhaps also we need to rethink and say that perhaps this gender thing is far much wider, because there could be compounding factors that really lead into certain vulnerabilities of certain groups, especially the women. So what are these complexities that surround the process of gender inequalities and all that? And how best can we be able to understand these particular complexities in order to be able to inform policies much more effectively? So I do appreciate, and I think for us, it's a question of continuous discussion. There's no one who knows everything, or there's no one who has all the solutions. I mean, the policymakers, like we have the honorable members here, Esther has given very interesting perspectives from the World Health Organization, and of course from the diaspora. The lessons are quite huge and really very useful. So we can see that everybody has something to bring on the table. And of course the researchers, in terms of trying to bring out some of these intrinsic issues and be able to inform policy. So in all, my passion is that we as the researchers, we can continue this kind of dialogues, and we can always continue to bring in the policymakers so that we have a kind of a common standing ground when it comes to some of these issues. And of course, as I've said, it is a collective effort, and it's something that all of us have to come together and to be able to address much more effectively. And with those few remarks, allow me to again say thank you. Thank you, the honorable members who are here, for your time and for giving this useful insight. We hope that we can continue the discussion and see what is it that we can do so that these kinds of platforms and dialogues are sustained. They're not just done once in a while, but we can see how can we progress some of the interesting facts that have come from this dialogue to be able to inform the legislative processes and to be able to make our settings, of course, looking at Nairobi, Kenya, and Africa, much more better. Thank you from the WHO. It's great that you have joined. It's a good thing to see that we can learn together from the ground and see what is happening. And these lessons can be cascaded to the international level, where some of the key decisions and of course resources can be leveraged. And from the diaspora, thank you, Matthews. Those are great lessons that we learn, of course, because the world is a global village, and there's a lot of things that are globally driven. So we look forward to continuing to learn from some of those great experiences. And of course, to all participants, thank you for your time and for your inputs into the process. And not forgetting Dr. Asenath, who has made this possible. This was great. When we started working with you, Daktari, actually, yeah, I didn't see this coming, but for us, I think this was a very strategic focus, and my encouragement is that we can continue with this kind of discussion. So thank you so much for putting this together. And to the other members of the team, we are grateful and we look forward to continuous discussion. Thank you so much, and may God bless you.